Welcome and have a wonderful session. I'll see you in half an hour.
Thank you very much, Roberto. I'm just going to go ahead and share my screen. And Ubina just confirmed to me that everybody can see my screen.
Yes, we can see it. Good.
Awesome. So good morning, good afternoon, good evening. And thank you for joining us today. My name is Ilodibe, and I'm Chief Executive Officer at AHA Clinics. And today I will be talking about leadership from the top, how I rethink leadership, and how I embed lean and sustain resilience at AHA Clinics in Nigeria. So this is the outline we'll be looking and working with today. But I just wanted to start with a thought. As CEO, I get asked a lot of questions every day. This is budget season, so a lot of questions around budgets, a lot of questions about going to market with products, a lot of questions about strategy, a lot of questions about growth. But I think that beyond everybody asking how we do what we do, the question that really keeps me up at night is, how do I lead when I do what I do? Because at the end of the day, leadership drives culture and it strengthens our teams and drives lasting impact. So I wanted us to start with this thought as we go into the presentation today. Now, what's changed with leadership modules? The old way was very autocratic. The leader sat in a gilded or ivory tower and sent out instructions, and the worker bees just did what the leader did. It was all about command and control, and it emphasized authority. And a lot of the times it stifled creativity and collaboration. The leader was the final decision maker, the voice that everybody had to listen to. But then there's a new way, and I like to say new, much more comfortable way. At AHA Clinics, whenever I'm, on a panel, asked to introduce myself and asked to say what I do at AHA Clinics. To be honest, I think that my role is more like Chief Alignment Officer. I'm standing and saying, this is the vision, but really getting out of the way for the very probably smarter than me people who work to do their work collaboratively, efficiently, and effectively. So essentially, my role is to inspire the teams to create an atmosphere of collaboration so that we can all achieve the vision that I try to share, the why we do everything. And what is our why? We call it our true north. For those who are French, it's our raison d'être, it's our reason for being. These are the reasons we get out of bed every day. It's our North Star. And that is quality and patient safety. And to do that, we need to talk about the customer experience, because lean teaches us that patient-centered care is the bedrock of an improvement culture. I need to think about our people. We hire incredible people, but how do we train them? How do we empower them to produce excellent outcomes and to work collaboratively? We talk about financial stewardship. Beyond how we make revenue is how we eliminate wastes and increase productivity to increase value for our staff, our patients, our shareholders. And top of our mind always is impact. How are we impacting our patients, the communities that we serve, the nation which we operate, and in fact, the entire world. And we build all of this on these 10 building blocks of high-performing care, which we like to look at our culture of care, AHA Clinics. And at the beginning of that is leadership. Leadership will always drive the tone of culture at every organization. It's just what it is. And how does leadership do that? It is by using data that is generated from patient interaction and from indeed our day-to-day to drive improvement. It is from putting the patients at the center of their care. their partnership with the care providers to ensure that their care is contextually appropriate and fit for purpose. It is in the partnership with every member of the clinical team, because the patient journey is not fragmented. It is actually interactions at different touch points that make the patient have a good journey and good outcomes. And it's how, as leaders, we can collaborate effectively with our teams and allow our teams to collaborate effectively with each other to deliver good patient care. It is about how we manage individual populations. It's about how we ensure that care is continued even when we have to refer patients outside the clinic. It is about how we ensure that we remove the waste that is called wait. It is about how we ensure that we don't miss anything in the patient journey, that the care is comprehensive. And it's always about improvement, how quality drives us to improve, to look at where the future of medicine is, if evidence has changed, and how we can continue putting patients and delivering quality care. And our culture of improvement has been built on lean, because lean, the pillars of lean are quality improvement, continuous improvement, and respect. Respect for our patients, respect for our staff, respect for each other. And these are the things that drive the culture that is open, honest communication, that creates psychological safety that is needed to identify problems and improve them, both for the interest of patients, our staff, and our communities. So how do we do this? I've said a lot of words, everything sounds very nice, but how do we integrate this? How do we ensure that our true north is not just on the wall somewhere and something that we talk about? We operationalize our true north. Our vision is aligned with our practice. How do we do that? We use our true north elements as our core goals. And every team at the beginning of the year derives objectives and key results from those core goals. Every team has to have, quality goals, financial stewardship goals, customer-related goals, people goals, as well as impact goals, so that it's not just a vision that is in the boardroom. It is something that is living and active with our team members. And how do we do that? We focus on patient care. Every team has to have something that is customer focused, that is, we're getting feedback from the customers that is driving our improvement projects. I always say that one of the, quality improvement makes you very humble. It's important to understand that when you create a process, you go into it with assumptions, expecting the outcomes you expect. And sometimes it's not what you expect. And you need to be able to take feedback from the patients and put them at the center of care, so that we're adjusting and ensuring that we're building resilience, because we're listening to the people we serve and adjusting as appropriate. It means we create an atmosphere of team collaboration. Every team has a daily huddle. Every department has a weekly huddle. Even the leadership team has a weekly huddle. And beyond that, every quarter, we review the OKRs and the key results that we have set to make sure that we're still aligning with vision. For example, during our daily huddles, every day has a quality focus around the International Patient Safety Goals. Whether that is Hand Hygiene Monday or Patient Identification Wednesday, we use that to keep quality at the center of care. The other thing is that every week, every team has an improvement huddle. We give the teams an opportunity to identify waste, identify processes, defects, things that haven't gone well during the week, during the month, and come up with a framework on how they, as the frontline teams, can improve them and empower them to improve their own processes where they work. So for us, lean is not just a set of tools. They're really nice tools, but it is our culture. It's our culture of improvement. It's how we continue to enhance our processes and drive our success. Is the reason why we're the only JCI accredited ambulatory care facility sub-Saharan Africa is the reason why we've gone for ISO accreditation for our labs. It really is our culture of improvement. It is about respect. I teach a class to my teams called Crucial Conversations that is all about creating psychological safety and creating an open, honest line of communication between managers and their team members, between team members and each other, so that we can all strive for improvement. It's all about collaboration. In our offices, we don't have typical offices. We have team spaces because we believe that creating that creates that enabling environment, that leveling where we are not using walls to define hierarchies. It means that teams can come to each other and talk to each other. Medicine by nature is inherently very collaborative, and there is nowhere where it's more important, the saying that the whole is better than the sum of its parts than in medicine. And so collaboration is everything for us here. And essentially, it's all about empowerment. Everybody's success is our success. And we continue to encourage everyone to contribute ideas, because some of the best ideas are from the people who live and breathe the processes every day. I'd be remiss if I don't talk about this. This is probably one of my favorite tools as a leader, because sometimes I get busy, different engagement, different places where I have to represent, and you can lose touch. Even though I'm a clinician, I don't see patients every day. So sometimes when I'm seeing the numbers and I'm seeing the outcomes, I don't understand what it takes to get there. I design a process that I think is patient-centered, but it's creating bottlenecks and it's increasing wait time. How am I going to know if I don't go to the front line to ask them if it's actually working? I go in and I observe. Look at what's happening. Look at how long it's taking maybe a front desk officer to collect and register a payment, and ask myself, could this be shorter? It's about engaging and asking the team members, what frustrates you about your work today? How can I make your life easier? And it's about looking for avenues to improve. One of the things that I love about doing Gemba walks is engaging my teams. And I recently did a Gemba walk with my team and with one of my teams at the front desk. And I was like, oh, I'm here. Are you happy to see me? And they were like, oh, yes, we're very happy, because the last time you came, you noticed that we had to keep walking up and down to go to tell the lab that there was a patient waiting. And you asked, what do you think we can do to solve it? And they thought about putting a call button. And after you left, we installed that call button and we've stopped moving up and down. So we were excited because we know that when we talk, we'll find out another way to make our lives easier. So it's not just about going, it's about getting feedback. And the most important part that builds trust with our teams, it's about implementing the feedback, because listening is not complete if you don't understand and you don't give feedback and you don't implement. Now, what is resilience? What is true resilience? It's not just about surviving challenges. I work in healthcare. I don't know what patient is going to walk through my doors. I don't know what case. I don't know if it's going to be an accident. I don't know if it's going to be an easy day. So I work in a lot of uncertainty. I also work in Nigeria, and I work across different geographical zones in Nigeria, with each with its own peculiar problems. So it's not just about surviving for me. It's how I can create systems that are replicable, and can adapt without breaking. And to do this, this approach supports growth. It supports stability. It's the reason why if you give me a building today and say you need to start a clinic in 1 month, as long as I have the staff, I have a team, we have a process, a standardized process, we have a formulary, we know the equipment, we know what we need to do, the workflows, with the informatics team, we know what we need to create on the EMR, and we can operationalize in a month. And that is what resilience looks like. It's building systems that are replicable and are adaptable. And what does that mean? The resilience equation talks about what you need to create resilience. Talked about lean systems that promote efficient processes and teamwork. Removing waste, over processing system, having inventory, how to remove weight. It talks about psychological safety. How do we ensure that the teams are able to communicate with each other and trust each other to deliver excellent patient care? It's about sustaining resilience. We've gotten our JCI accreditation for the second time. This is because we've been able to sustain what we learned and continue to implement. And this is about lasting impact, how we commit to continuous improvement, build strength. I always say that as a leader, you have to go into every situation with the humility to understand that everything you do or every assumption you have made may be wrong. And in the interest of continuous improvement, that means that you need to be able to listen and adapt to what the patients are saying, what your staff are saying, what the environment are saying, so that 10 years, your organization still exists. So I would be remiss if I didn't talk about a patient story. At AHA Clinics, we start a lot of our meetings with a patient story, because in the interest of patient-centered care, it's important that in all our meetings, we keep our focus in focus, right? Which is the patient. So I want to use this patient story to demonstrate how lean can help in a crisis situation. So in August this year, there was a protest in the country, and which meant that we were essentially put in an unplanned lockdown. We have a crisis management team at the clinic, so we usually know what to do in a lockdown. We adjust schedules, we know who will be on duty, we arrange transportation so people are safe, we communicate with our patients, what if there are going to be any changes in clinic times. We have that process down flat. However, what was different in this situation was that we had a patient on observation that needed a transfusion. As per our protocol, because the patient was a sickle cell disease patient and was beginning to show signs of anemic heart failure, we wanted to refer to a partner. Unfortunately, our partners refused to take the patient because there was a lockdown. Now, probably a year before, we had decided that we wanted to try a hand at having the ability to transfuse. Also because of a patient story where we had had a sickle cell patient that we had referred to another hospital, and we had even managed to procure the blood ahead of time, but they forgot the blood in the ambulance and the patient ended up not getting her blood products. So we had decided we wanted to start transfusion. We created the SOPs, we had done the team trainings, we had bought all the equipment we needed to do this transfusion. We'd even done run-throughs, but we've not had a patient for a year. And now we have a patient that we can't refer who has anemic heart failure, and we need to do a transfusion in the middle of a lockdown. So we defaulted to our process. We already had a process. We had people who had been trained on the process. Unfortunately, people on duty that day were a little new, not part of the training. So we had to deploy the ambulance to unpick the people who had been part of the process, who went to the blood bank, got the blood, then the people who had been trained to administer the blood, and the patient got her treatment. Now, we realized at the end of the day, the things that we had assumed when we were creating the process was not really as we expected. So it meant that we needed to debrief, taking in context these assumptions that we had made and altering our process. Now, how does this demonstrate lean? First of all, value focus. We focused on why we needed to do this transfusion. The patient needed it. And even though this was not a comfortable time, it was, let's say it was the best of times and it was the worst of times, we had to activate all of our training. Because we had already had a value stream, process map, there were team members and policies and processes in place to actually perform this transfusion. We had a flow. We knew what we needed to do. We had a partner where we needed to get the blood. We had a contact there. There was a staff member who had established contact with them, and that's the person we needed to pick. Yes, eventually we found there were flaws in our flow, but we had a flow. Then there was a pull system. There was demand. We're not transfusing for transfusion sake. We had a very sick patient that needed a transfusion. We respected our people. We knew that we had trained good people. And even though a lot of the managers were not on the ground because all of us were locked away, our people were able, because we knew their capacity, able to make decisions about being picked up, going to those locations, getting what we needed to get, and patient getting her care. And of course, in the interest of continuous improvement, we realized the process was not perfect. We didn't realize that cross-matching was going to take as long as it did, which meant that we needed to adjust the types of patients we could even transfuse. For example, if the patient was bleeding out, that was not the place to now go and do 2-hour cross-matching. That's a patient we needed to refer. And also helped with standardization. We went back to the process. Now that we understand it better, we standardized it. But guess what? Maybe the next transfusion we'll learn more. We're always open to learning. So what are the 3 takeaways I want to leave you with? You need to lead by vision. You need to inspire your team with a clear, shared direction. Share your why and let your why become their why. You need to understand that lean is not a set of tools, it's not a kit. Lean is culture. You need to embed lean principles in a way that fosters collaboration and creates an efficient and effective work environment. And very importantly, resilience is systemic. Resilience is built into the fabric of the organization. It's not just my willpower. I want to believe that if I leave EHA clinics today, EHA clinics will continue to run, not because I'm a great leader, but because we've built resilience into the fabric of the organization. Thank you very much for taking the time to listen to me. I'll be open to any questions, comments, contributions at this time. I'm going to stop sharing my screen now.
Thank you, Dr. Fanaya, for that very beautiful and brilliant presentation. Beautiful as always. So I have a comment here. It's sort of a comment and a question in the chat area. So please, everyone, if you have a question, I could take your questions now. So he said, this is from, okay, sorry if I can't get your name very well, Ilodibe, right? Is it defining the standard process and the SOP is good, but we always face the challenge of having people learning it and following it consistently. How do you succeed at that?
I think everybody has the same problem, right? You create an SOP, you do a training, and then in the midst of a crisis, stuff falls away. One of the things we try to do beyond creating the SOP and training is also to trial it and say, okay, this workflow, how does it really work in real time? But very importantly, it is, if possible, use outcome measures, KPIs, right? Is there a way we can track if this process is being followed? And is there a way we can measure the impact of the process? If we've set a benchmark for 90, are we meeting it? Why are we not meeting it? What are the root causes and how can we improve? And also setting up incident management systems that allow staff to report when things are not going well. Like I said, SOPs are great, standardization is great, but a lot of the times we make these things on perfect assumptions. Oh, if A is equal to B, then C will happen. Sometimes it's not like that. So it's important that when incidents are reported, you go back, do a root cause analysis, reflect, find out if your process even makes any sense. And if it doesn't, adjust and come and retrain, measure impact. So I always like to say quality is a journey, it's not a destination. And when you treat it that way, it's easier to understand when they are waxing and waning. I'm always more concerned when I see, an outcome that is 100% consistently, because I know that that's usually not true. I'm scared of 100%. It means that either we're lying or we're not measuring properly, right? Because humans are fallible and we need to build systems that understand that.
Okay, so thank you for that. There's a hand raised. I think this person want to talk. That is Marie-Jose Broadcast. All right, so I'm going to allow you to. I'm sorry, apologies. uh, so, Marie-Jose, would you speak?
Hi, could you hear me?
Yes, we
Yes,
can
we
hear.
can.
A very nice presentation. Thank you. You know, it's also not so easy to pronounce my name because I'm Lithuanian, you know, it's like from different, well, but I'm living in Norway. Really, thank you for Infunania, if I am correct pronunciation.
Well done.
Sorry for my pronunciation. I would like to ask about something about like how to measure like values like in the company like accountability, like trust, respect, because this is a software like our principles that we need from me, but sometimes to leaders or to involve people to engage, you know, it's really important, you know, lead by examples, but like to measure accountability, trust, respect, it's
Mhm.
really difficult if you understand. Could you share maybe some practical experiences or how to advise to how to go in this kind of road and how to land people? Because I believe that this is not one day.
Mhm.
Because the challenges is always about leaders and people engagement. But could you maybe tell some stories? Thank you.
Yes, that's a very good question. How to measure trust, how to measure accountability. So there's this, and this is for healthcare, you know, there's this really great tool by AHRQ called a culture of safety audit. And it kind of helps us. The culture of safety audit asks questions. I feel trusted and empowered to do my job. You know, my leaders listen, they lead from, you know, and then also lean has those tools as well. You know, lean maturity surveys actually ask those kinds of questions. And what I love about the lean maturity surveys is that it's a scale of 1 to 5. So you can see that, okay, when you first did your maturity, maybe on the leaders Gemba walk, maybe on the manage on trust and accountability, you're scoring a little low, and you can actually come up with how to improve those. So look for the lean maturity model that also has like steps on how to improve, and ask those questions about accountability, about Gemba, about your teams feeling empowered, and also the culture of safety audit, even though that is kind of very specific for healthcare. So those are some of the tools that we've used. I remember the very first time we did the culture of safety audit, one of the biggest things we saw that people were afraid to report incidents because they felt we had a blame culture. And that has changed drastically in the 3 years that we've implemented Lean, right? So absolutely, I understand the problem with measuring some of those softer skills, but yes, there are tools available that you can use. And the Lean maturity model is very good, especially if it's not healthcare.
So we just have 1 minute, less than 1 minute to go. Matthew, I don't know if I can take your question still, but someone is asking maybe 2 questions, Dr. Ifeanyi, if you can do something very fast. They say, you talked about resilience. What could you do when resilience is affecting negatively? And then as CEO, what are your most valuable daily routines? Yes.
So maybe I'll start from the last one. My most valuable daily routine is reviewing Asana. Asana is our project management space. It's also how we operationalize our daily huddles, which is where our teams talk about the conversations, what has happened in the daily huddles, where there are blockers. So I always start my day reviewing Asana, because my responsibility is to remove blockers. So I go in, what are the blockers? How can I remove it? That's my best daily routine. When
All right, guys. Sorry to cut you off. I'm sorry. Thank you so much. I'm sorry to cut you off. Wonderful to have you here. Thank you for sharing your story. It's been wonderful to listen to it. I appreciate you being here. Have a good day, guys. Thank you.
Thank you. Thank you, everyone.
Thank you, everyone. Bye.